Good day, everyone. Welcome to our Nloa 1 long test for rationalization. And I'm actually in charge of discussing nursing practice 3, care of clients with physiologic and psychosocial alterations, part A, specifically topic on care of adult clients in pain. Let's begin with question number 1. A client in the post anesthesia care unit or PACO 45 minutes post abdominal surgery displays a blood pressure of 30% above their preoperative baseline, has a heart rate of 115 beats per minute, and is restless. The client's pain scale is 3 over 10. Given these findings, the following actions should a nurse consider: understanding that pain may be a contributing factor despite the client's reported pain score, except A. Administer beta blocker immediately, as sinus tachycardia is a common dysrhythmia caused by hypovolemia. B. Recognize that hypertension is a very common post-operative complication, often caused by pain or conditions that increase vascular resistance. Or C. Assess for other causes of sinus tachycardia, such as anxiety and hypovolemia or hypoxia, and administer appropriate analgesia immediately, as tachycardia and hypertension can be manifestations of untreated pain. So in this case, what we are looking for is actually a wrong answer. So when we talk about this one, the patient is actually 45 minutes post abdominal surgery. So the increase in the patient's blood pressure and tachycardia is actually strongly suggesting that there is an increased cardiac output, which can be caused by presence of pain, also anxiety, or conditions that increase vascular resistance. The presence of sinus tachycardia is commonly caused by, of course, this presence of anxiety, pain, and hypovolemia or hypoxia. Even if the patient reported pain scale of 3 over 10, which is actually very low, and there is an increase 75% of postoperative clients, they may actually untreated for pain, making analgesia administration a relevant action. So what is actually wrong here is option letter A, because beta blockers may be given for sinus tachycardia, and that is the primary treatment for the underlying cause, such as pain, anxiety, hypovolemia, or hypoxia. So in that case, we're actually focusing more on uh, letter A is the best answer because that is not focusing on hypovolemia, but a focus here is basically on sinus tachycardia. So the best answer for number one, letter A. Number two, a post-operative client recovering from extensive orthopedic surgery is highly anxious and reports incisional pain controlled by patient-controlled analgesia or PCA, but states the pain flares up significantly when attempting to mobilize. To enhance this client's ability to move and address the nursing diagnosis of risk for impaired mobility related to procedure or pain, or both, which non-pharmacological intervention should the nurse prioritize? So select all that apply. 1. Initiate transcutaneous electrode nerve stimulation. Number 2, place a client in a lateral position to open the airway and facilitate deep breathing. Number 3, ensure the client maintains nothing by mouth status to reduce aspiration risk. Number 4, coordinate relaxation and music therapy sessions. Number 5, apply heat or cold to the surgical site as appropriate. Of course, when we talk about non pharmacological interventions, these are options for post-operative pain management, and that includes TENS, and that is number 1. So that is your transcutaneous electrical nerve stimulation. And second is we also have uh, relaxation, and that is letter number 4. Coordinate relaxation and music therapy sessions, because aside from relaxation, that will also include music, and the application of heat or cold is included. So, what is the correct answer here for number 2 is 1, 4, and 5. That's 1, 4, and 5. So, uh, number 2 is an intervention to establish or maintain patent airway is actually required for the immediate recovery phase, and not specifically an intervention for pain related impaired mobility. While option 3 is actually a preoperative intervention used to reduce aspiration risk and not during the postoperative phase. So answer here is 1, 4, and 5, and that is choice letter D. Number 2, choice letter D. Let's proceed now to question number 3. The perioperative team is caring for a client undergoing a lengthy procedure Under conscious sedation, the circulating nurse notes the client reminisces and moves slightly on the operating table, and the blood pressure monitors trends upward from 120 over 80 millimeters mercury to 148 over 92 millimeters mercury. The following actions are mandated by the interpretive nursing diagnosis and assessment criteria regarding pain management in this specific context, except we're looking for a wrong answer. Letter A, recognize the need to monitor pain scales, especially during conscious sedation. Letter B, increase the rate of IV fluids to treat the hypertension as volume overload is the most common cause of intraoperative blood pressure increases. Letter C, monitor vital signs, autosaturation, and level of consciousness, which is required monitoring during conscious sedation. Letter D, monitor the anesthesia provider, notify the anesthesia provider that the client's physiological response may indicate pain related to physiological response to surgery. Of course, when you talk about conscious sedation, vital signs, autosaturation level, and level of consciousness must be monitored. And pain scales must also be monitored, especially during conscious sedation. And the observation of movement and rising BP suggests that the nursing diagnoses pain related to physiological response to surgery. And what is strong here is option B, because volume overload is listed as a cause of postoperative hypertension, but addressing or assessing for physiological responses to pain is the immediate priority during sedation. So the best answer for number three is letter B. Four, a client in the back who is displaying increasingly agitated behavior, picking at their lines and attempting to climb out of bed. The nurse performs an assessment to address the potential nursing diagnosis of disturbed thought processes, which assessment finding must be ruled out immediately before attributing the agitation to pain or anxiety. A. Laryngospasm, B. Hypoxemia, C. Response to drugs, or D. Pain. So, if the client is actually exhibiting disturbed thought processes, an example of that is agitation, the nurse must always rule out if there is presence of hypoxemia, because we know if there is presence of restlessness, we talk about the hypoxia. Although effects of anesthesia, of course, presence of pain or anxiety are also causes of disturbed thought processes, and also, drug effects or hypovolemia may be underlying causes of associated cardiovascular instability. Hypoxemia is a priority in this diagnosis of mental status changes. So the answer here is letter B, hypoxemia. 5. The nurse is reviewing the pharmacological pain management options available for a client undergoing major surgery expected to cause severe postoperative pain. The client is requesting maximum pain relief options to prevent complications based on the source material, which option represent multiple pharmacological techniques available for managing severe postoperative pain. A use of spinal or epidural anesthesia. B, number two, infiltration of the surgical site with local anesthesia. Number three, administration of inhaled aerosol with racemic epinephrine. Number four, patient control analgesia. Number five, application of biofeedback. Of course, this is a select all apply medication. The question is about pharmacological. So, of course, correct. Number one is correct. Number two is also correct. Uh, Number three is not post-operative. This is not a medication for pain. So, wrong. Number three is wrong. And number four is correct. And number five is actually wrong because biofeedback is non-pharmacological. So the best answer here is one, two, and four. And that is choice letter A. Number five, choice letter A. Six, a client received major peripheral nerve block. Regional anesthesia is transferred to the PACU. The client denies pain but reports numbness and tingling in the surgical site or extremity. Which assessment parameters should the nurse prioritize to manage the intraoperative nursing diagnosis risk for interrelated to sensory or motor deficit secondary to sedation and anesthesia? One, assessment of social support. Number two, documentation of full sensation or dematum level. Number three, assessment of circulation, including capillary refill and pulse. Number four, assessment of the ability to move the extremities. Number five, monitor for late manifestations of malignant hyperthermia. Of course, this is a select that applies. So when managing the risks for injury related to sensory or motor deficits secondary to anesthesia, part of the key assessment is the ability to move the extremities And of course, we are also going to look into dermatom level or the documentation of food sensation. And we also include here pulse, specifically in the peripheral area, circulation, and capillary refill. Letter A, assessment of support. It relates to the preoperative nursing diagnosis of self-care deficit. And number five is related to complications of general anesthesia, and of course not regional anesthesia. So the best answer for number six is 234. That is documentation of sensation, assessment of circulation, and assessment of ability to move extremities, except one and five, because they are not specific for risk for injury. Number six, the best answer is two, three, and four, and that is letter D. Two, three, and four. Seven. The nurse is implementing non-pharmacological interventions for a client whose postoperative pain is only partially relieved by PCA. The client reports anxiety related to the post-op status. All of the following non-pharmacological strategies can simultaneously address both pain management and the client's anxiety, except A, biofeedback, B, verbal reassurance, C, utilizing a forced warm air device, or D, positioning. Of course, when we talk about non-pharmacological interventions, that includes for pain management. Of course, we mentioned one already earlier, that is positioning, verbal reassurance, relaxation, and biofeedback. So these techniques are actually widely used to manage anxiety, and your use of forced warm air device is an intervention that is used to address imbalanced body nutrition, body temperature, sorry, imbalanced body temperature. So number seven is letter C. Let's proceed to number eight. A client who receives spinal anesthesia for a procedure develops sinus bradycardia in the PACU. The nurse suspects that bradycardia may be directly linked to the anesthetic used. Which intervention are most uh, which intervention are immediately related to managing sinus bradycardia in the PACU based on potential causes and specific treatments? A. Administer atropine. B. Number two, assessing for hypothermia and hypoxemia. Number three, assessing for high spinal anesthesia as potential cause. Number four, preparing for to suction secretions to remove irritating stimuli from the airway. Number five, administering beta blockers to control the heart rate. Of course, sinus bradycardia can be caused by vagal stimulation, and and that includes hypoxemia, hypothermia, high spinal anesthesia, and certain anesthetic drugs. So if you're talking about uh, atropine, is actually a medication that is usually used for treatment. And for number four, it relates to the interventions for laryngospasm or bronchospasm. And number five, that is used for sinus tachycardia, not bradycardia. So the answer for number eight is one, two, and three, except number four and five. So eight, one, two, and three, and that is choice letter D. Number nine, the nurse is reviewing the client's chart before a planned surgery. The history notes previous complications include difficulty controlling pain, post-cholecystectomy, and current anxiety related to the upcoming procedure. Drawing up a knowledge of the perioperative care and potential risks, the following are the preoperative assessments most critical for planning comprehensive post-operative pain and anxiety management, except A. Reviewing the signed surgical consent and blood administration consent. Letter B. Identifying any education needs related to upcoming procedure or home care of equipment needs. Letter C. Reviewing pertinent high client history, including previous surgeries and any complications. Letter D. Assessing for history of smoking, alcohol, or drug use, as this may impact medication emergence and pain needs. So in this case, we're looking for a wrong answer. Uh, Letter A, that is actually necessary preoperative checks, but they do not directly contribute to planning specific postoperative pain and anxiety management based on the history, and also on education needs and substance use. So B, C, D, they are correct, but we're looking for a wrong answer. So what's wrong here is letter A, because that is on the preoperative part of the nursing care. Number nine, alpha. Number 10. The nurse evaluates a client's current postoperative pain management strategy involving infiltration of the surgical site with local anesthetic. Despite this measure, the client reports increasing discomfort when repositioning, which action represents a principle of comprehensive postoperative pain management that ensures the client's well being. One, immediately inserting an artificial airway if the pain causes decreased air movement. Two, recognizing that the pain may be undertreated for pain and require intervention. Number three, combining pharmacological interventions with non-pharmacological interventions such as positioning and verbal reassurance. Four, documenting the pain scale scoring as all clients must be assessed for post-operative pain. Five, assessing if the pain is causing hypertension or sinus tachycardia. So in this case, we're looking for uh, select Adalapay answer. So letter A, number one, that actually relates to establishing a patent airway due to ineffective airway clearance, which is considered to be first priority. But this is an extreme measure, not directly indicated solely by increasing discomfort during repositioning. Number two is actually correct because up to 75% may be undertreated. And number three is actually correct. Pharmacological options should be supplemented with non pharmacological interventions like positioning and verbal reassurance. And of course, it's also important for us to include pain scale monitoring and assessing for pain which is causing hypertension or sinus tachycardia. So what is not included here is number one only. So the answer here is two, three, four, five, and that is letter B. 11. A client receiving conscious sedation for an unpleasant procedure is monitored by the intraoperative nurse. The nurse utilizes pain scales to assess pain. If the client reports increasing discomfort, the anesthesia provider may opt for infiltration of the surgical site with local anesthesia. Why is the application of local anesthetic infiltration considered an important strategy for pain management in this context? Number one, it is a form of regional anesthesia that results in a reversible loss of sensation in a specific region. It is one of the multiple pharmacological options available to treat post-operative pain. It allows client to tolerate unpleasant procedures while maintaining adequate cardiopulmonary function. It delivers anesthetic agent to the surgical site by local infiltration. It is preferred over PCA as PCA carries a higher risk of aspiration. So we know that infiltration of the surgical site with local anesthetic is listed specifically as one of the multiple pharmacological options for post-operative pain. So local anesthesia involves the administration of an anesthetic agent to the surgical site by local infiltration of anesthesia. Number one, that is regional anesthesia, which includes caudal, epidural, spinal, and at the same time, major peripheral nerve blocks. But infiltration is classified as local anesthesia. And then option two is actually correct. Multiple pharmacological options available to treat post-operative pain. But option three, that defines consolidation, and option four is actually correct. And option five is actually uh, comparison unsupported by the sources regarding aspiration risk. And status reduce aspiration risk preparatively, but PCA is not listed as a valid pharmacological option. So what is the correct answer here is only 2 and 4, and that is option letter D. 12. A client in the PACU exhibits hypertension caused by pain following pain medication administration. The client's blood pressure returns to baseline. The nurse continues to monitor the client, understanding that the resolution of pain helps mitigate the risk of which other post-operative complication often linked to the client's current status. Reduced cardiac output related to hypovolemia, sinus tachycardia, risk for aspiration, fluid volume excess, disturbed thought processes. Of course, in this case, we're looking for uh, a select all apply. So, of course, we know that pain is listed as a common cause of hypertension, as well as sinus tachycardia and disturbed thought processes. And by treating the pain, the nurse is reducing the triggers of tachycardia and altered mental status. So, option one, that is for hypovolemia, And option 5, that is option 4. Option 4 is for fluid volume excess. So that are separate causes of decrease or increased cardiac output. So hypertension may be caused by fluid volume overload. The scenario specifies the initial cause was pain, not volume status. And aspiration risk is linked to gastric contents entering the lungs and favors like obesity or depressed level of consciousness, not directly to pain resolution. So answer here is only uh, sinus tachycardia and fluid volume excess. No, that's disturbed thought process. Sorry, that's disturbed thought processes. So except 1, 3, and 4. So the answer here is 2 and 5. That's letter A. 13, I think this is the last number. A client post-hysterectomy reports a high pain score. The nurse plans non-pharmacological pain management to supplement the prescribed opiates. The following combination of non-pharmacological interventions should the nurse select that maximizes cognitive and physical diversion from the painful stimulus, except tense and relaxation, music and verbal reassurance, position and biofeedback, heat cold application, and NPO status. The answer here is letter D, because we know that non-pharmacological interventions include tense, relaxation, music, verbal reassurance, positioning, and of course, a combination of heat and cold application is preoperative measure to reduce aspiration risk, and that is not directly related to uh, patient post hysterectomy. So the answer for number 13 is a delta. So that is it. Thank you so much, everybody. See you again next time. Congratulations, everyone.